Hello and welcome to another exciting and educative episode of The Time with a Specialist on HealthAfrik. This program is brought to you by the Association of African Universities, AAU, the voice of higher education in Africa. And my name is Isabella Teta Hinakwa. Today we are continuing our discussion on dental caries, but then we'll be looking at the one that affects children, that is early childhood caries, also known as rampant caries. And I know you wouldn't want to miss that. So stick with us for an exciting discussion after this break. Stay tuned. You're welcome back from the break. If you just joined, this is The Time with a Specialist on HealthAfrik. And like I mentioned earlier, today we'll be looking at a condition that affects children when it comes to dental issue. It's a condition that causes pain, also causes discomfort, and also the overall well-being of our children, and that is rampant caries. And joining us here is our very own Dr. Nana Akonorbea Addo-Kwafo from Dr. Martin's Carie Dentistry. Hello, Doc. You're welcome to this episode.
Thank you.
And I must say, you're looking really beautiful.
You're looking beautiful too.
Thank you. To start with our discussion, I'd like you to give us an overview when we talk about early childhood caries or rampant caries.
Okay, so early childhood caries, as you said, is also known as rampant caries. It's also known as nursing caries.
Okay.
So it is defined as the presence of one or more decayed, missing or failed tooth surfaces in any primary tooth in a child 71 months of age or younger. Yes, and they are classified into three types. We have the type 1, the type 2, the type 3, and this is based on the severity. So the type 1 is mild to moderate. Usually with this one, you have isolated lesions on the teeth. So basically, the teeth has like different surfaces. So with the mild to moderate, you can have the caries on maybe just one tooth surface, and usually you find them on the upper incisors and which is like the upper front teeth, but the molars are hardly affected in the mild type. But when it comes to the type 2, which is the moderate to severe, you can have like the lesions on multiple surfaces of the teeth. So maybe the front teeth, you can have it at the front, at the back, on the sides. Then also the molars are usually involved. And the type 3 is the severe type. So with the severe type, you would have so usually because of the position of the tongue, you realize that the lower front teeth are not usually affected. But in the severe type, you have it affecting all teeth, including those teeth that are usually protected by the tongue.
Okay. So with these types mentioned, what are the key characteristics when you talk about rampant caries?
Yeah, so usually it starts as a white spot, like along the gum line. Then it progresses to a yellow to brown discoloration with a cavitation. Then it continues to progress till the pulp, which is the area that has the nerves and the blood vessels getting involved. Yes, and usually the first teeth to be affected are usually the 4 upper teeth. So the 4 upper incisors. Yes, then later it spreads to the upper and lower first molars. Then it spreads to the upper and lower canines. Then finally it spreads to the upper and lower second molars. So basically you can say that the teeth are affected in the order in which they erupt. And as I said earlier, they hardly affect the lower anterior teeth because of the position of the tongue. Yes.
You know, when kids are born, it takes time before they develop full teeth. And so does this affect children that have fully developed their teeth, or even as an infant, you can also develop rampant caries?
So you can start developing rampant caries once the first teeth comes into the mouth. And as I said, there's a distinction. So when we are talking about early childhood caries, we are not talking about children who are in mixed dentition. That is, children who have primary and permanent teeth. We are talking about just the primary teeth alone. And that's why I give the age range of 71 months and below. So that's about 5.5 years and below. But from 6, when they start having permanent teeth coming in, that's not any childhood caries.
Interesting. And also in our previous discussion on caries, you made mention that acid, bacteria, and the consumption of sugar are the causes of caries. Now, someone watching ask, how about children? What are the causes of these type of disease? What causes them?
Yeah, so with children, it's similar.
Okay.
So bacteria. So as I mentioned, Streptococcus mutans is the main bacteria. And children get it sometimes from their caregivers. So like as they are growing up, sometimes with the kissing and all of that, you can introduce that into their mouth. And also with their diets. So eating like excessive sugar and taking in sugar very often can also help with that. Yes, and also a susceptible tooth surface. So once the tooth surface is available, so the tooth surface that usually comes into contact with the sugar very often, you can have like caries developing there. And also it happens over time, as I said there last time. So all of these factors are there. It is not just 1 day or 2 days, but once there's constant, the constant presence of it would cause like the development of the caries.
And aside the causes, I know probably there'll be some risk factors when it comes to the development of rampant caries. What are these risk factors?
Okay, so when it comes to the risk factors, so there's excessive and frequent intake of sugary foods, as I mentioned earlier. Then also with the children, the main risk factor is putting them to bed with a feeding bottle in the mouth or with a breast in the mouth.
People do that a lot.
Yeah, people do that a lot. So usually when you're asleep, there isn't like production of saliva and all of that. It's more like your mouth is stale, and that is why usually you wake up in the morning and there's a kind of smell in the mouth. Yes, so with all of that stillness happening throughout the night, sometimes maybe the mother puts the breast in the child's mouth, then she sleeps off, then the child too sleeps, then throughout the night or for a greater part of the night, the breast is in the mouth. You are more likely to develop caries. Sometimes too, maybe when the child is crying, they can just put the feeding bottle in the mouth, or even sometimes they sweeten the pacifiers and leave it in the child's mouth to sleep with. Yes, and also we have socioeconomic status. So in areas where there's low socioeconomic status, children do not get access to fluoridated toothpaste and all of that. And at that stage of development, without the fluoride to strengthen the teeth, the possibility of caries developing is very high.
Okay. Now, you made mention of some of the symptoms or some of the early symptoms for rampant caries, but then I'd like you to touch more on that. What are these symptoms? What would detect that this is rampant caries on a child?
Okay, so I would like to use this as an opportunity to also talk about the stages of development.
Okay.
Yeah, so firstly, we have the initial reversible stage. So at that point, you see a chalky white discoloration along the gum line. And at this stage, you may or may not see plaque in the child's mouth, but this stage is reversible, as the name suggests. Yeah, so with improved oral hygiene and usage of remineralizing agents like fluoride, you'll be able to reverse the process and it wouldn't progress. And we have the damaged carious stage. At this stage, that's where you see the yellow to brown discolorations with cavities appearing on the teeth. Usually, at this stage, the dentine is involved. There isn't pain categorically, but you'd have sensitivity to cold stuff. Yes. Then we have the depletion. So with the depletion, there's involvement of the pulp. There's involvement of the pulp, which is the area that has the nerves and the blood vessels. And as I said, it usually starts with the incisors. So the incisors may have pulpal involvement, but the molars may just have like cavities in it. Yes, and at this point, usually the child will complain of pain. We also have the traumatic stage. So at this stage, like the caries has gotten so bad that with just like a little trauma, the teeth start breaking off because they become like very weak.
Now, interesting. Before we go for break, you know, growing up, I do hear that as a kid, you need to have some kind of bent or caries on your teeth. It's part of growing up. And I would like us to discuss the impact. You know, during my research, I noticed that they said aside you having the paint on your teeth, it also affects the well-being of children. So I'd like us to discuss the impact of this disease.
Okay, so usually with what you said, I've also heard it being said before, and usually people have the perception that, oh, because those teeth are going to fall off for new teeth to come, so there's no need to like pay attention to it. But as I said earlier, the teeth come in a particular sequence. Likewise, the permanent teeth, they also come in a particular sequence. So if because of caries you lose the teeth before the time that the successor is supposed to come in, there's a likelihood that you will lose that space. Yeah, and that's what causes like different forms of malocclusion. So you lose the space, the permanent teeth are coming in, there isn't space, you have all of these misarrangements and crowding and all of that. Yes, so it's as a result of early loss of primary teeth. Then aside that, with the caries, usually when it gets to the traumatic stage or it gets to the depletion, the child is usually in pain. So the child experiences chewing and biting difficulties. It could lead to reduced appetite. The child doesn't have appetite for food because he doesn't want to go chewing. Yes, and that can eventually lead to weight loss. It can lead to like sleeping difficulties. And also with like all of the teeth like looking funny and all, sometimes it makes them irritable. It gives them a low self-esteem, and it can go a long way to affect their performance in school as well, especially when other kids tend to like laugh at them.
This is really crucial. It needs much attention. We'll go for a quick break. When we come back, we'll continue the discussion. Please stay tuned. We'll be right back. Hello Africa is a live breakfast show that aims to give you, our viewers, an informative, entertaining, and energizing start to your day. This isn't just another news show. It takes the form of vibrant magazine packed with news reviews, lifestyle features, engaging interviews, and interactive segments that put you at the center of the action. All you have to do is grab your coffee, get comfortable, and join us for the Hello Africa morning show.
We are here to kickstart your day with the news and stories that matter to you, alongside all the fun and inspiration we crave.
Every morning, join us for
the latest headlines in African higher education, science, and
quick and informative newspaper and online news review.
Lifestyle tips on fitness, nutrition, fashion, and beauty.
Inspiring interviews with influential figures and everyday heroes.
Performances and interactive contests, and so much more.
In Ethiopia, Salam Africa.
In North Africa, Alan Afrikia.
In Swahili, Jambo Afrika.
Tune in every Monday from 8 a.m. to 10 o'clock GMT. Join us to make it a fantastic day together.
Hello Africa, your daily connection to the continent. You're welcome back from the break. This is Time with a Specialist on HealthAfrik, and if you just joined, you've not missed anything. You can go on our social media platforms, Association of African Universities on Facebook and YouTube, to follow the discussion. And before we went on break, we were discussing the impact of early childhood caries. You may think that it is nothing, but then it goes beyond the look. Hello, Doc. Thank you for sticking with us. Now, before we went for break, you made mention of, I think, a dental issue or dental disease, which is malocclusion. I would like you to touch on that, explain to us what that is.
Okay, so malocclusion is basically a deviation from the normal bites. Okay. So when you smile, there's a pattern of like arrangement of the teeth. Sometimes people smile and maybe you see some of the teeth, some in, some out. Yes, and all of that. So that's basically like in layman's term what like malocclusion is.
All right.
Yeah.
And now continuing with our discussion, I would like us to, looking at the impact, I would like us to look at the treatment available for rampant caries. Being a dentist, what are some of the treatments you offer to children with such disease?
Okay, so with the initial lesion where you see the chalky white discolorations on the teeth, at that point, we just do mainly fluoride therapy. So depending on the age of the patient, if the patient can handle scaling and polishing, we just do some scaling and polishing around. Then we do fluoride treatments. Aside like the usage of the fluoride toothpaste, we have like in-clinic fluoride treatments we can do for children. Yeah, just to make sure that the tooth is remineralized and the progression of the caries stops. But let's say at that stage, the parents don't notice it and it gets to the stage where there are cavities with the yellow discoloration, yeah, at that point we just clean out the cavities, then we fill it with like a material just to make sure that it doesn't progress, and at least the tooth can stay in the child's mouth till it's ready to fall off. Yeah, but at the stage where it gets to the pulp, there's a treatment that we do. So we have pulp treatment for children. Yes, we actually go in, then we remove the diseased pulp. Yeah, then we fill it just to make sure that it's maintained. And usually with that treatment, the other alternative to the pulp treatment is extraction. So once the pulp is involved, it's either a pulp treatment or an extraction. And usually most parents don't see why they should go through the pulp treatment, because after all, if you take it out, new ones will come. But as I explained earlier, we are trying to make sure that the tooth falls out when the permanent ones are ready to come in, and not way before then. Yes. So either the pulp treatment or the extraction at that stage.
Okay. Now, with the fluoride treatment, how is it done? Is it that you infuse the teeth in the fluoride?
Yeah, so we use fluoride gels. So we apply the fluoride gel around the child's teeth. Then we allow the child to stay for some minutes. Yeah. Then afterwards, the child washes out. So within that period of time that the gel is around the teeth, you have some of the fluoride diffusing into the teeth and making it stronger.
Someone will ask, after treatment, is there is there a possibility that the child would develop or redevelop the rampant caries, or after treatment there's no need for you to worry?
Yeah, so after treatment, it's possible for the child to develop the rampant caries again. And that is why after treatment, we give you oral hygiene instruction. So basically, it's because maybe the oral hygiene wasn't good, and that is how come the child developed it. So when they come in trying to take history, in trying to know what happened, yeah, we ask various questions. And if the child sleeps with a feeding bottle, sleeps with breast in the mouth, the child doesn't brush twice a day, the child doesn't allow the parents to brush, all of those things will come up with the history taken. Yeah, so we do the treatment letting you know that there will be a relapse if you don't take into consideration all these things and put a stop to them.
With that said, I'd like us to explore the steps or the preventive measures that parents or caregivers can give to their children to prevent the development of rampant caries.
Okay, so first I'll start with toothbrushing. You have to make sure that the child brushes morning and evening using a fluoride toothpaste. Yes, and you have to make sure that you reduce the intake of sugar. The child doesn't take a lot of sugary stuff. Even if the child takes sugary stuff, try and let them rinse it out of their mouth. Yes, and also from the mothers, you make sure that you don't leave breasts in the mouth for the child to sleep with, or leave a feeding bottle just because you want your peace of mind and you don't want the child to cry. It's not a habit that you should allow the children to develop, because eventually it's going to destroy all of their teeth. Yes, and also you have to incorporate regular dental checkups. Most parents feel like, why should a child, maybe 1 year to 5 years, go to the dentist for what? But it's just like regular checkups. If you come in and there's nothing there, we just do cleaning for the child. If the child is cooperative enough, then we just do the fluoride therapy. And if there's something, we pick it up early and we are able to do something about it before it's too late.
Now, talking about dental checkup, I would want to ask, at what point should a parent seek a professional? Early childhood caries, and also is it advisable that they do or they come for the dental checkup even if the child is not experiencing it? Is it like advisable that probably so far as the child has developed full teeth, he or she has to come for dental checkup?
So the thumb of rule is the first dental appointment of the child should be 6 months, which is when you're expecting the first teeth to come in. Yeah, so usually from birth, they'll let you know that when you see the first teeth, which usually comes around 6 months for most children, you should bring them in for a checkup. Yes, so you don't have to wait till the full sets. You don't have to wait till you see a problem. Yes, but 6 months, when you see the first tooth coming in, you just come in for a checkup. Okay,
that is when there's no sign of rampant caries.
No. However, even at that point, the child may have just like 2 or 3 teeth in the mouth, but you have to come. Usually, most people don't do it, but in other countries, it's something they practice. Even when like you give birth to the child, you're going for antenatal and all of that, they would tell you to book for a 6-month dental appointment for the child because they're expecting the first teeth in by then.
With the oral hygiene steps you gave, you made mention of brushing teeth. I know we've done some practical steps of how to brush the teeth, and you also mentioned the type of brush and then the sizes to use. Would you probably, with a recap, mention how for children, how caregivers can brush their teeth to ensure that caries is not developed?
Okay, so with that one, so it's something you're teaching the child, but as you are teaching the child to brush, the child must also see you doing it. Yeah, so basically like leadership by example. Yeah, and also you'd have to encourage the child, make the brushing more fun for the child. So now on the market, we have like different types of toothbrushes with a whole lot of action figures. So, you know, maybe the child likes Spider-Man, the child likes this and that. You go for a brush with like those characters so that it makes it more fun for the child. Yes. But I also like to say that usually they should try not to threaten the children with like coming to see the doctor and all of that, because it becomes a very big problem when they come to the dental clinic, because it's like from home they've been told that, oh, I'll take you to the doctor, they'll give you injection, they'll do that. So they come and the cooperation is very difficult. Yes. And but even before you bring them to the clinic, you just let them understand, oh, you're just going to look at your teeth and it's going to help you. Then at the end of the day, like, we are all good to go.
That is well said. I know parents do use doctors to threaten their kids when they are being stubborn. If you do, I'll take you to the doctor. They'll give you an injection or they'll take off your teeth and all that. That is well said. I think we've come to the end of our discussion, but then I don't know if you have any last word. Dr. Martin's dentistry, where is it located, or talk to our audience, and any last word for our viewers? Okay, so Dr. Martin Carey Dentistry is located in the Atlantic Mall, which is located at the Atomic Junction, the Atomic Roundabout. Yes. So over there, we provide all kinds of dental services. Yeah, we see children, we see adults. So whatever problem you have, you can come in for a consultation. We do a checkup, and whatever it is, we'll let you know, then we take it up from there. Thank you very much, Dr. Akonorbea Addo-Kwafo, for sharing your insight with us on Rampant Caries. I hope we meet again on our next episode. This brings us to the end of today's episode, where we discussed early childhood caries or rampant caries with our very own Dr. Nana Akonorbea Addo-Kwafo from Dr. Martin's Carey Dentistry. I would urge us all to take this serious and then practice good oral hygiene, as it is the key to prevent all these dental issues. My name is Isabella Teta Henakwa. You can follow our discussions on our social media handles at Association of African Universities on Facebook and YouTube. See you again in our next episode. Bye.